A sinus infection can happen when the sinuses become swollen or filled with fluid. Families may notice stuffy nose, runny nose, thick mucus, facial pressure, headache, cough, tiredness, or pressure around the eyes, nose, cheeks, or forehead. Some sinus symptoms may start after a cold or respiratory infection. Medical care may be needed if symptoms are severe, last more than 10 days without improving, get worse after starting to improve, or include fever for several days. Seek urgent help for swelling around the eyes, vision changes, confusion, stiff neck, severe headache, trouble breathing, chest pain, or if the person appears seriously ill. For emergencies, call 911 immediately. The Care Now Private Duty Care Companion app helps families learn warning signs, track symptoms, and stay organized. Educational use only. This does not replace medical care. Visit our app to learn more.